Hello, one and all.
Hello. Good morning, Sandesh. Good morning, doctor.
Hello. We are here for a conversation with a mainstream doctor. And as I introduce Dr. Shridhar, you will be amazed with the background and experience he comes with. So let's begin this conversation. I'll start with a short introduction of myself and Abhishek, and then go from there. I'm Sandesh Bhatt, a certified low carb nutrition and metabolic health coach from DLife.in, India's first and only award winning low carb platform. I have with me Abhishek Kakhandi, also member of DLife.in and a metabolic health coach. He's my co host today. DLife.in was founded in 2014 by Anup Singh, a silver medalist from IIT Roorkee and the recipient of Icons of India Award. Anup is the pioneer of the low carb movement in India with his path breaking protocol of 100 grams per day, making low carb, high fat diets possible for Indians, including Indian vegetarians. In 2021, D-Life launched its Diploma course, which is the only course in its segment that is approved under NSDC Government of India and the only course with a 144 hours CPD credit. Anup Singh, along with Shashikant Iyengar, are the organizers of this metabolic health conference. Our guest today is Dr. Sridhar, also a D-Life certified metabolic health coach. Dr. Sridhar is an alumnus of Armed Forces Medical College, Pune. He did his post-graduation in anesthesiology from the same institution, has served 33 years in the armed forces in his specialty and various administrative appointments all over the country and abroad, before retiring in 2023. Dr. Sridhar is currently settled in Bangalore and practicing freelance. Dr. Sridhar, would you like to say a few lines
Yeah.
on how you're feeling today?
Good morning, Sandesh and Abhishek. Thanks for that generous introduction. I hope you can hear me.
Yes, we can hear
Yeah.
you.
Yeah. So, firstly, I would begin by saying that I am very thankful and very happy to be a part of the D-Life community where everyone is constantly learning and getting better every day. It's a beautiful, eclectic mix of people coming from all walks of life from all over the world. It's fantastic. Yeah.
Perfect. Awesome. Thank you so much, Dr. Sridhar. Abhishek, why don't you get the discussion started for us?
Sure, Sandesh. Good morning, doctor, again.
Yeah.
So, let me start with this question. So, why do you think most doctors are hesitant to recommend low carb diets for long term health benefit, despite the growing body of evidence supporting their health?
Yeah, I think this problem stems from two issues. Primarily, one is inertia, and second is vested interests. So let me talk about the inertia first. See, the current curriculum of education at undergraduate level in most medical colleges is well behind the latest updates. This happens due to the nature of medical education, where it takes a long time for a discovery to get validated and for the safety of the general population. So by the time the latest research paper gets incorporated into the undergraduate textbooks, it's already about 5 years older or more. There are medical colleges and doctors who keep themselves updated, but in the overall scheme of things, they are fewer and far between. So the inertia in the system and the fear of litigation, which keeps most practitioners well within the accepted boundaries of guidelines issued by their own respective societies. Yeah.
Nice, doctor. So, my next question would be many doctors worry about the long term effects of low carb diets, such as potential risk to heart health or nutrition deficiency. How do you address this common question?
Yeah, so as we have learned over the past few days and earlier also, there is sufficient research on this subject and clinical material that is already available which debunks these concerns. Many of these myths have been dispelled by earlier speakers at this conference as well as the two earlier editions of Metabolic Health Conference. See, carbohydrate is one macro which can be totally substituted by proteins and fats for the production of energy. The reverse is not true. As to the risks, one thing is to be noted that low carb diet is never practiced in isolation. So, if there is a pre existing disease under treatment, or if the client is apparently at risk for complications, one should always consult one's physician before starting a different diet or an exercise program. Any changes made should be gradual, giving time for the body to adapt. All changes in medication are always under a doctor's supervision, keeping the clinical status and laboratory parameters in mind. It will always be preferable to consult a doctor who is open minded about low carb, who is willing to understand where the patient is coming from. And in the near future, with the increasing use of AI assisted templated medical practice, the personal touch provided by the doctor is going to become more and more important. I hope that answers your question.
Absolutely, Dr. Shridhar. So there is a perception that low carb diets are difficult for patients to sustain over time. Do you think this is a valid reason, and how it can be mitigated?
Uh, yeah, this is a common perception which primarily results from the fact that low carb diets involve some changes in habits and food patterns, which can then later be sustained over a lifetime. You see, changing habits has always been difficult, whatever your bad or good habit it is. If the parents eat a certain type of food, the rest of the family develops a certain liking and familiarity with the dishes. There are, it it becomes a sentimental thing also. Then this becomes difficult to change after a certain time due to force of habit. But in the long run, if the why is clear, the how will happen. You see, good metabolic health coach will explain the why of low carb diet, and once the client is convinced of the logic, the changes can be implemented. Furthermore, if the parents are already on a low carb diet, the parents are already on low carb diet, the children will be well adjusted to it from the beginning, leading to a healthier lifestyle in the long run for the whole family. And once the families start getting better, it percolates into the whole society, and the society over a period of time gets healthier. But to come back to your question, are low carb diets sustainable and healthy over a long term? Absolutely. See, many in the D life community itself have been on low carb diet for a prolonged period, some for over a decade. So, and they are really, really healthy. All their lab parameters and all are top class. So, low carb diets are sustainable and healthy over a long period of time. There is absolutely no doubt about it. What do you think, Abhishek? You are also a low carb coach.
Yes, I totally agree, Dr. Sridhar. This happened with my family. Yeah, I
Yeah,
totally agree.
it
Yeah,
has
yeah,
happened with all of our families. We all have, made things better for our own near ones.
correct. Yes. So let me ask this question. How do you think this medical training adequately prepares doctors to understand the long-term implications of dietary interventions such as low-carb nutrition?
So no, I would say no. You see, diet and meal planning is really not a part of the medical curriculum because medical science, as taught now, is geared more towards detection and treatment of acute diseases. Prevention, whether with the help of diet or behavioral changes, is incremental and it's less glamorous. Hence, not very attractive to either the clinicians or to the medical students who look up to those teachers. And because of the long follow-up period required to see the results, once you start a low-carb diet, it takes 2 3 months to see the results. I mean, students are impulsive; they don't see these things. So this thing should definitely be a significant part of the medical curriculum, as the long-term beneficial effects are undeniable. So I'll give you an example here. See, you see any TV serial, House, Flying Doctor, you will always see some doctor landing up at a stage where somebody is coding, arrhythmia is going on. He comes, gives a dose of a drug, and the patient sits up all right and starts smiling. I mean, this looks very good. But if you start a low carb diet and you imagine a TV serial of low carb diet where the one episode says you start on this, leave rice or reduce it, and then the next episode is slower and slower, nobody will have interest in it. So this is the thing. It is less interesting, it's kind of boring, but it's definitely more effective. So slow and steady is also equally important. Yeah.
So why don't you take over, Sandesh? Now you can ask some questions.
Yeah, it's been already very nerve-wracking, interesting, doctor, some of your clinical pearls. So Thank you so much at the outset for that. A few questions that are running on my mind. One of the parts that I would, want you to tackle is, are there gaps in long-term research on low-carb diets that might make doctor hesitant to endorse them for extended periods? And how do we bridge the gap?
So I would say, you see, I think that the relevant research regarding the health benefits of low carb diets already exists, and in sufficient quality and good quality as well. So, however, as many speakers in this and earlier metabolic health conference have pointed out, it's not the lack of research, but the vested commercial interests that
Mm.
prevent this from being accepted in the mainstream medical science very quickly. So, there are two ways this gap can be bridged. Firstly, it is important for everyone to acquire knowledge on their own from credible sources. Everyone. You see, sunlight is the best disinfectant. The knowledge, the transparency which you gain on your own, that is the best thing which can happen to you and your family. One has to keep your own mind open, keep learning from diverse sources, do your own research to learn the truth, keep talking to people, see what works best. And when when the patients are well informed, the medical fraternity also has to keep pace with it. So it's a win-win for actually both of them. The other way to change the situation is to change the political discourse and societal discourse as is happening in the United States. Sandesh, I mean, did you read the Feb 13 executive order of President Trump on making America healthy again? Have you come across it?
Yeah, I've come across this, but I didn't go into it deep. Why
Yeah.
don't you
So
enlighten us?
so if you go through it, it has basically a lot of specific points on grain
Mm.
consumption, seed
Mm.
oil usage, and all these things where they're actually trying to reduce the production of grain and change it into other food items which are healthier. See, these changes will probably come first in the United States of America. You see, as it's still the thought leader in most fields of
Right,
knowledge
right.
and in soft power. Others will follow later. But eventually, and especially in the Indian context, people will come to know that D-Life and Anup had been right all along. So instead of waiting for the knowledge to get fully mainstreamed and to commit for it to come from the USA, is better that all affected people acquire it on their own from freely available resources like all these MHC videos. There are some 90 of them, and if you have a problem, get a consult from a certified metabolic health coach when necessary. Improve your life on your own. Do it yourself.
Thank you, Doctor. I like the couple words that you mentioned in your answer. One was knowledge and soft power. I think both
Absolutely
go so together. Just with
correct.
knowledge, it's hard to implement when the soft powers are so strong at us. Thank you so much. I'll move to my next question here. Do you think patient compliance and success stories can help convince doctors to recommend low carb diets for long term use? What's your viewpoint?
Yeah, Sandesh, definitely. You see, usually people are hesitant to start something new as a long-term habit. I mean, they are comfortable in their own skins. And for the fear of having to revert if the new thing does not work, it's some kind of loss aversion kind of thing. So it becomes easier for them to understand and follow if someone has already done it earlier, and the results are there to see for themselves. See, as the medical fraternity sees these positive results, they will be amenable to change. You can't deny the truth which is happening in front of your eyes. Shifting the perception of low carb diets within the medical community will take time, and that is where the efforts like MHC and D-Life, they make a big difference, because you have a
Absolutely.
ready-made source of knowledge which people can refer back to and say, oh yeah, this study makes sense. Let's change our own practice. Like I'll give you a personal example. I treat all of my near and dear ones. My driver, he lost 8 kgs over 3 months,
Wow.
and all the other people in the street keep asking him like, how did you do it? And he just smiles, and like even his own GP asks him. So it's people do notice when you're getting healthier. So all these things will once you have good cases and people respond to it, people will notice and they will come to you for getting better.
Yeah, I like that personal story, and I especially if on the grassroots, like you quoted
Absolutely
your driver. is a because they are in the ground, they are interacting
And
properly
they
with a
cannot
lot more
afford
people.
long-term medical treatment from outside,
Great
I
point.
mean, so it's tough for them. So they're really happy regarding this.
Yeah, and as a coach, I have also seen that ground level, workers who are mostly, on the field, right, in day jobs, they actually fare really well, really well. They follow the protocols really well. Awesome, great, thanks, doctor. What are the most common misconceptions about low carb diets that lead doctors to dismiss them as a long-term solution?
Yeah. You see, there are many such misconceptions, dispelling myths propagated by these vested interests and then sustained by the mainstream media for, pecuniary reasons. It's an important part of societal and patient education. We have to be aware about all this. There are any number of misconceptions. Fat is bad, fats are bad, sodium is bad, cholesterol is bad, protein harms the kidneys. They are very common things. You will keep seeing articles on newspapers and snippets all the time. There are always exceptions for a sick and compromised patient, but for a normal, healthy population, none of this is true. See,
Mm.
so many of these misconceptions have been demolished thoroughly by earlier speakers in this conference with lots of facts and logic. So I would recommend anyone seeing this talk to go through as many videos of the current and earlier metabolic health conference as possible. I guarantee that once you go through them, you will be absolutely clear in mind as to what is the correct state of nutrition, what you should be actually eating. To use an analogy, if you once you take the red pill of low carb, you can't go back to the matrix. You see it very clearly.
Yeah, that's fascinating. I really loved that, last line. And I do want to, request the listeners what Dr. Sridhar said with his over 30 plus years here in the army as a servicing doctor there. And he is actually quoting and being so humble to I request every one of us here to watch through all the videos
Correct.
of the previous metabolic health conference because they are all
They
pearls.
are a gold mine of
So
knowledge. I mean, you just have to go through.
yeah, actually. So thank you so much, doctor. Yes, I have definitely taken the red pill. So I'm not going back to the matrix whatsoever. Ever. I'll pass over to Abhishek now. Over to you, Abhishek.
Yeah, nice conversation, Sandesh, with Dr. Sridhar. Yeah, now, Dr. Sridhar, how do you counter arguments from peers who believe that low carb diets are too restrictive or harmful in the long run?
Okay, I mean, see, this is a mainstream narrative which has to be demolished brick by brick. You know, like one of the earlier speakers said, how is it that a heart attack suffered by President Eisenhower in the early 50s, beginning of the Cold War, it enabled the inversion of the dietary guidelines so badly, leading to establishment of false dogmas, which still holds sway. In which field of science would an untruth last for 7 decades? All the fields, they rapidly turn over their entire knowledge in 1 or 2 years. I mean, software life is 6 months. So you can't say this was happening in the 50s is still true. These things are these things have to be broken down. You see, the only way to break this logjam is to counter every argument against low carb diets logically, backed with clear scientific data. Discuss the stories with others, explain that eating correctly just requires science and plain common sense. Eating correctly doesn't require a double blind RCT. That a patient who gets metabolically better with improved parameters from certified labs and has improved his or her own quality of life, this cannot be dismissed offhand by saying that you are n equal 1, so your experience doesn't matter. Medical professionals asking for double blind RCT everywhere need to realize that anecdotal evidence is not inherently invalid. When lots of anecdotes join together, they make a valid group. You see, focusing solely on large scale statistical significance, it overlooks the importance of individualized care and treatment. Every patient is absolutely different biochemically, biologically, genetically. You have to tailor these treatments specifically to everyone. And when it comes to underpowered studies, you have less participants in the study, this exacerbates the problem. A small statistical thing looks very big, whereas actually statistically is absolutely wrong. And also, as far as long run is concerned, say D-Life itself, it has 3,000 odd recipes. Half of them are vegetarian. Even if like 1,500 vegetarian recipes, there are 365 days in a year. It'll take 3 years to go through the entire vegetarian recipes only. I mean, you will never repeat a recipe if you are cooking. So there is no way you are going to get bored. This is all a fallacy. There are enough things, enough ways you can make your own life interesting even on low carb. As to the other main thing is to put the healthcare load in context for all my medical colleagues. See, India has 212 million diabetes cases in 2024. We have 26% of the world cases, one-fourth of the world load. Add to this the disease burden of obesity, hypertension, and long-term complication of all three diseases. It's simply overwhelming for any healthcare system, leave alone a country like India with limited resources. You see, doctors are very expensive to produce. The number of seats are limited. If you want a good doctor population ratio of this thing, it is very, we will not see it in our lifetimes. There is just not enough seats and enough money. So the better thing is, instead of increasing the number of doctors, let's make the number of sick people less, and uh, that is very easy. I mean, you learn good things, you learn good habits, uh, improve your own health. You don't need to go to the doctor if you don't fall sick. That solves a problem. And the doctors are freed up to see the really sick cases, trauma, and, other biochemical diseases, structural diseases. So they get to see what they actually want to do, and not these low hanging fruits that you see somebody for 2 minutes and then prescribe an antihypertensive or anti-glycemic drug and just let them go back month after month, year after year. Later, they end up with other organ complications, then they come for more serious diseases. This is really not required. I mean, all these patients can be healed by low carb and appropriate medical health practice. These patients, they absolutely do not need to clog up the OPDs and wards of resource care hospitals. They just don't need to go there. I mean, you see, medical facilities should be freed up to take care of non-preventable diseases. I think that is the way this country has to go forward. Yeah.
Nice one. Nice answer, Dr. Shridhar. So my next and last question would be: how can doctors influence not just individuals but entire communities to embrace low carb as a sustainable lifestyle?
Yeah. So this is something, I mean, we have to do ourselves. This has to start from our own homes. So there's a quote in the Bible, physician, heal thyself. The
Yeah.
context is that no one will believe a word of what you say till you practice it yourself. खुद करके दिखाना. So doctors have to lead by example and normalize low carb in their own ways. This requires a cultural shift in thinking, a greater acceptance, and then educating our own families, then our friends, then taking short workshops in schools and efforts towards reaching out the community at large, and then educating them on metabolic health. This is essential. Once this percolates into the community, that is, I mean, this is also a doctor's role. A doctor, if you see the Latin translation, a doctor is a teacher.
Mhm.
So, I mean, we have to go out and teach. And I will encourage all the medical practitioners of today to lead first by example by themselves. Follow a low carb diet, share your knowledge across various digital and print platforms, conferences, workshops, including medical colleges. And as time goes on, the knowledge will only get refined and get better, and is good for everyone in the long run. Yeah.
Thanks, Dr. Sridhar. You want to ask Sandesh anything? Any more questions?
Yeah, I do. And, every minute of Dr. Sridhar's wisdom, we will take it, isn't it? So, uh, Dr. Sridhar, a question that's coming up in my mind is how do we bridge the gap between the existing research, which you already called out that there is plenty, in different great channels. One of that is D Life, who you already have been a beneficiary of. and the practical knowledge that doctors need to feel confident about prescribing them. So one is having the research, but I think doctors will also need to have some of the practical knowledge. So I just
Yeah.
wanted to hear from you how you are going about now in your
So,
transition from a
so
mainstream doctor.
I think, see, the thing about it's like a new subject. You have to learn it. Like when you go from one medical professional to another to
Mm,
first finish anatomy and physiology, then you don't know anything about pathology. Then you learn pathology. Then you don't know anything about medicine or gynecology. Then you in the next year you learn about gynecology. Low-carb is like that. It takes time to learn.
wow,
I mean,
yeah.
you have to read up, then you have to start applying all this knowledge slowly to your own patients. Uh, it's not just the nutrition part of it, it's the overall part of it. Any other deficiencies, the overall pattern of eating, any behavioral changes required. It's a whole thing which has to be learned. And then, if I just give a diet plan and the
Mm,
person follows it for a week and then relapses after a week, it's of no use. So I have to plan keeping all of these things in mind, and this is how this has to be taught in a uh, in a graduated manner. So you go step by step. First, acquire all the knowledge as to how low carb works, what is the role of insulin, how it has to be measured, what when are the times when it increases beyond a certain limit, and how to reduce the overall insulin discharge. So all those things have to be learned slowly, and then you apply it to each patient individually, tailor the approach to each patient, the diet as well as the medication, and then slowly over a period of time, you realize that some things work in some people, some things don't, and then I mean you will see the joy of re-prescribing medicines very soon. It happens.
great. Doctor, I mean, we are very fortunate to have a ex-serviceman. Just wanted to ask you a little bit about, the diet in military. I just got a curious question coming up. Does it have enough protein? Is it just carbs? How do you assess? And if you had an opportunity to go back and advise, what would you do?
So I would say that, see, initially the diet in military has been designed as a like these people are supposed to work really hard. So mm, it depends on the soldier and where he's posted and all that. The diet can vary anything from 2,500 to 4,000 calories, say high altitude and difficult places, submarines. All these things require slightly different diet. It's all scaled out. But the point is, the basic ingredients like seed oils, grains, they are still the same. So these are the ones which have to be changed slowly over a period of time. And also, since these locations are in far off places, you have problems of storage, logistics, and you have to, some places are unapproachable in uh, harsh weather. So you have to, keep these things which will last for 6 months. So all those things, keeping all those things in mind,
Hmm.
it is, I would say that the diet can be over a period of time, it can be definitely adjusted to low carb this pattern for all the soldiers also. Of course, their carb requirement is sometimes really, really high because the environment is so tough that whatever you eat just doesn't get absorbed. So some situations are very different. But as far as people staying in plains or in cities are concerned, they can definitely go back to what other, I mean, their civilian counterparts are doing across the street. Uh, that is, it is possible.
Great, great. I think that is a very unique, different position you have been in as a medical professional in
Yeah,
as the services.
yeah, it's very
Just
interesting.
observationally, what have you seen, from a metabolic syndrome perspective, in the military? Have you seen them a lot? And has that been different, for your observations from the
I
mainstream
think,
when you come in?
yeah, I would think that a lot of it mirrors the civilian population because, after all the people who work in the services, they are drawn from the civilian population. So broadly, it will mirror what is happening in the society. Though not so much because they are physically selected out. So
Mhm.
a lot of the unhealthy population gets sorted out.
Right.
But whoever is remaining is healthy. They proportionately they would mirror the same illnesses as what is there in the civilian population. And see, as an anesthesiologist, I would say that when I get a patient, I would prefer him to be, SA1 with no
Mm.
illness, no comorbidities. Uh, the point is that these things are amenable to treatment. So there is no reason for somebody to be sick of, say, sick for obesity, hypertension, and diabetes. These are mostly treatable. So it's a good thing that these things, low carb is slowly coming into the open discussion, and I'm sure it will percolate into the services also. It won't be long.
Great, Dr. Sridhar. Just another follow-up there. Do you see any? I know you've also been in the mainstream military and also in the admin side. And I know troops and servicemen rotate these areas. Do you see a difference between the admin side and the field operations with regards to metabolic health issues?
Uh, Not really, because see, like any government service, the soldiers keep rotating between various stations. So, like if the person is already ill and carrying a disease, he just carries it to another station.
Hmm.
Whereas uh, administratively, it's my job to keep my troops healthy. So they are fit for action whenever it's required. So I need most of them to be fit and fighting all the time. So we have annual medicals and timed medicals in which we try to keep checking and weeding out people for treatment all the time. So it's that way we are much more scrutinized. The patient population much more scrutinized and is always under the microscope. You see everyone every day. You really know that this guy is putting on some weight. You just tell him on his face, you've got to lose weight. So it's not like any other organization. So you have certain standards, and then you have physical fitness standards. You have to cross those limits, otherwise you don't make it. So things are, yes, definitely much more organized in the services,
Right,
and
right.
I feel that these changes are easier to implement there because it's all top down. So
Mm.
if low carb is implemented from top tomorrow, everybody will eat low carb. There's no question. So it's like that. So it's a good organization, and probably let's see how things go along. Somebody will see the light. Somebody in power will see the light and implement it there as quickly as possible.
Yeah, I hope is like a Pandora's box. It can open anytime, right? So
Yeah.
that's great. Just one question on protein. I know we've been emphasized and heard so much from our previous speakers here about protein, and I see it as a nutrient for healing and repair and restoration and growth.
Correct. Correct.
Where is the armed services currently with regards to protein measurements? Do you count the proteins?
We don't.
And is
Yeah.
there a focused intention on a protein-based diet?
No, I would say that right now the food mm, uh, pattern which is followed is mostly based on what the uh, the food pyramid, which has
Hmm.
all this has been handed out in the US. Maybe some local adjustments are there, some millets and all that. But as people, I would say that the armed forces are slightly quicker on the uptake. When they see a problem happening, they will go to the root of it much more quickly compared to
Okay, great to
the
hear that.
civilian. Yes. So if I see hypertension in 10 of my soldiers, I would say I would quickly get to it. What is happening? I can't post these out to people out to field and all. It's a restriction on their work, this thing. So I have to be always on my toes as to their health. So I would feel that the change is easier to implement there. Protein percentage, as far as their diet is concerned, I think it is sufficient because a lot of people eat non-veg. So there is
Hmm.
no problem about eggs or meat or anything like that. There are veg troops, but they are usually from, say, like Haryana or Rajasthan, and they drink liters of milk and paneer. So, as far as
Great to
diet
hear
is
that.
concerned, good diet is concerned, there's no lack of it. The forces that way are very generous with their proportions. So it's just that You have to eat the correct thing for the correct kind of work. So it is possible, definitely. Courses are that way much better organized.
Oh, great. Thank you. You gave us so much insights, which, as a general common man outside, we wouldn't know and have an opportunity to learn about how forces eat and the meal plate. Just a final question. We have another 5 minutes, but maybe a minute or two for this question, which I know you are very passionate about, which is mostly on your field. In your line of specialization, especially when you're in the ground in the armed forces,
Yeah.
is there a difference in your treatment protocols when it comes to a metabolically healthy versus unhealthy patients? I think yesterday when we were in the back room, you were talking about you in the army hospital, you also have to treat nearby villagers. You have
Nearby.
to treat
Yeah.
nearby accidents. So can you speak
Excellent.
about how the protocols change in a
So,
couple minutes?
so most of our patients would be servicemen, the serving people, and their dependents. Uh, but I mean, the dependents would obviously are drawn straight from the civilian population, the parents and the wives and children. So they are not medically sorted out. Whereas
Mm.
the soldiers themselves are probably much fitter. So, but the overall pattern of diseases is usually, I would say, 90% the same. So whatever treatment I would do in a government medical hospital is the same thing I would be applying in my setup. And then I have to be equally careful about all these metabolic diseases, cardiovascular diseases, all the respiratory problems. So it would be of, I mean, it would be of greater definitely use if everyone is slightly healthier. Because as I think yesterday Dr. Monel pointed out, you have a
Yes,
healthy
yes.
patient, he recovers faster. There are lesser secondary infections. Those things are these things are very helpful in faster turnover of patients, and hospital-acquired infections and all they reduce a lot. So it is better that I get metabolically healthy patients rather than somebody who is sick. And we also do preoperative assessment if somebody is not really settled and the
Mm.
surgery is not urgent. We would tell him, get better, show us a better result, and then come back. So we always try to optimize these
Great
patients
to
as
hear
well.
that. Awesome, awesome. Dr. Shridhar, thank you so much. This brings us to the end of our conversation. Thank you to my co-host Abhishek, and thanks, Doctor, for sharing your
Thank you.
perspective. I'll have Shashi and Anup here to, join in quickly. Hi, Shashi. Go ahead.
Hello, hi.
Hello, Shashi.
So, Doctor, thank you very much for insights, and I think that we could get a lot of valuable insight from a mainstream doctor, particularly on the metabolic health. And we also got good insights into the bit of the other side, what's happening in the dietary pattern of military. In fact, you'll be interested to know that they have tried low carb diet in US military, and they have
Correct.
found significant weight loss. Not
Yes,
only
yes.
that, they have done extensive studies on ketogenic diet, on also exogenous ketones in Navy SEALs, and they found the performance to be much better. Those studies
Much
are
better.
all there, it's
Yeah.
published. It's there in the Harvard CHN site also. So these applications are very useful. In fact, Dominic D'Agostino, who is one of the leading researchers in ketogenic diet, so he has tried out these exogenous ketone and ketogenic diet in Navy SEALs, and they were very significant improvement in them. Very excited to know all these applications are there, even in military.
Yes, definitely. I mean, any high performance area, sports and this thing, it would definitely work.
So thank you very much, Doc. And is Anup Singh around? If he's around, we can get him. Otherwise, fine. So fine. So Dr. Shriza, what is your final message to India?
My final message to, I mean, everybody, whether it is of the medical fraternity or not, is to, acquire knowledge on their own and uh, get, if there is sufficient knowledge out in the open, you have to learn it. Don't listen to dogmas and all these things. Do your own research. Get well yourself. Teach your family. Teach your children all the good habits, and subscribe to good resources to learn from this. And as for the medical fraternity is concerned, I would say keep your mind open and look out for these latest studies. And I mean, low carb definitely has to be mainstream. It's no longer. It can't be. It's the elephant in the room. You can't ignore it. So it will sooner or later it will be the thing. So just keep
Thank
your
you.
mind open. Keep learning. every day get better. That's all.
Thank you. Thank you, Dr. Shridhar. Thank you, Sandesh.
Thank you so
Thank
much.
Abhishek.
Thank you.
Thank you.
Thank you.
Thank you, doctor.
Thank you.